I don't know why I'm crying. That's weird.
It's
It's
okay. It's
trauma.
okay. It's a safe place. You can cry here. All right, welcome back, guys. We are back with episode 28 of Are We Doing This? Hey, Lauren, how's it going?
Hey, how's it going? Not bad.
Hi.
I was just I like I
Uh,
know it's only been 2 weeks, but I feel like I haven't talked to you in a while. I don't know
I
why.
know. I do feel like it's been a
It
minute. I
feels like a
think it's just
minute.
maybe we've just gotten so used to doing this every week that now we're doing it
Yeah,
every other week. It feels a
it
little
feels
longer.
a little
So,
gappy.
a little gappy.
Well, this episode is Are We Best Friends? Are we best
Yes.
friends now? So this is our guest episode. As you guys know, Lauren's challenge currently is to explore a potential career move into mental health. So she's been doing a lot of research, and as part of that, she wanted to talk to people who worked in different mental health, the mental health field in different positions or different specialties, I suppose.
Yep.
My social media client is a private practice therapist here in Fort Collins, and her name is Niki Froman, and she is just a wonderful human being and an open book. And so I thought it'd be fun to bring her on to give you a chance to talk to her about a career change and what it's like to work in mental health. And I thought I would
Hmm.
pick her brain just about perimenopause, transitions in life, and why we need mental health therapy right now. But I think
Yes.
it turned into us just kind of dumping all of our issues on her.
Well,
So
yeah, it turned into a really great conversation. We hope you guys
yeah,
find something in it because we talked about just things that we think a lot of our friends and women that
yeah,
are similar age right now are dealing with, which is like,
yeah.
is this perimenopause? Is this hormonal shifts? Is
This
this
is
some
ADHD,
other mental health issue? Is it
right?
ADHD? Yeah, like how do we sort through everything that's going on in
Hmm.
this time in our lives? And so, of course, that led us down our own struggles in this time of our lives. So I think
Yes.
we were just saying, like, hopefully, we didn't just take advantage of Nikki's time to help us
Yeah.
personally for an hour, but maybe
It's like
it'll be
our
helpful for you guys too.
it's our own little 2-on-1 session that you guys get to listen to now. But
Yes, but I'm excited to share it with you guys. She shared some really, I think, helpful stuff about what actually happens to our brain in perimenopause and
mhm,
things that are happening psychologically that are different and
mhm,
biologically. So that's really was fascinating. I didn't know that. And then talking a little bit too about sleep and other things, even the way trauma
mhm.
affects like how we're
Yeah.
feeling in our moods, which I think we've all experienced some degree of. So
Yeah, and
stay tuned for
redefining
that.
trauma, because apparently trauma doesn't have
Yes.
to be a big, like, thing that happened. It could be minor scale trauma that is still affecting
Yeah,
your life. So,
exactly. Anything that overwhelms you. So, a lot
yeah.
to learn from her. Also, I
Yes.
feel like I should say up front that even though Nikki is a licensed clinical social worker and she has her master's in social work
Yeah.
and is a clinician, there is no medical advice given
Yeah.
in this conversation. We are not doctors, and just keep that in mind in
Yes.
terms of please see your own physician if
Yes.
you need support. But we
Right.
do hope that you can get something valuable out of this conversation.
Yes. So exciting. All right. Well, let's hop into it because I think she's
Yes.
got a lot to share, and we did talk her ear off for quite some time. So
Yes.
this may seem like a long episode, but I promise I hope you'll get something from it because we thoroughly enjoyed it. So,
Yes.
all
Let's get
right.
to it.
So let's get to it. All right. So today on the podcast, we have Niki Froman, who is a friend of mine. Our kids go to school together. She's a licensed clinical social worker here in Fort Collins, where I live. She has over 17 years of experience in hospital and private practice settings. She specializes in supporting families, women, and children through life's most challenging transitions. Her passion lies in helping people identify their strengths and resilience to find healing, especially in times of change, trauma, or loss. So I just want to say welcome to the pod, Nick.
Yeah, thanks for having me. This is exciting.
We're so happy to
And
have
this
you.
is a topic that I love. So I'm excited to be here. I'm excited to let you kind of explore what questions you have about the mental health career
Mhm.
path, as well as anything within the scope of women's health too.
Yeah. And so, like,
That's
I know
awesome.
on a previous podcast, I had mentioned that I'm helping with your social media. And through that, I've been learning about mental health in a way that I've never I've never, explored this. So I'm learning a lot. And I know you're kind of having to handhold with me through that. But I was thinking how fun it
Right.
would be for Lauren to also have a chance to learn some stuff because her most recent challenge is, again, to explore a career change or potentially what that might mean for her if she wanted to look into a career change. So I thought maybe Lauren wanted to
Yeah.
launch this with some questions starting in that,
Sure.
that realm.
Yeah, absolutely. Well, so nice to meet you, Nikki, and thank you so much for joining us. And yeah, I mean, I think I could have a gajillion questions, and the little bit of research I have done of kind of looking into the field, actually, clinical social work, what you do is something that I've kind of honed in on. I really enjoy. I also have had a really great experience with an LCSW after the birth of both of my kids, honestly, those huge life transitions. And when I was going through the birth of my first kiddo, so I was becoming a mom, I also lost my dad in the same time frame, like within months of having my first baby. So that was a wild year for me. And
Yeah,
that was kind of what
absolutely.
led me to therapy. And I just thought of that was so interesting because reading more of your bio and more of your story and your mission on your site, like you talk so much about these big transition points, and so of course I naturally thought of that for me, and that was so pivotal for me to have a support um, and someone just to give me some context for like what I was experiencing. So I guess all that to say, I'm curious how what has led you to this point in your career and um, I guess tell us a little bit more about your background and maybe what gives you such passion for like women and families and transitions, if that makes sense.
Sure. So, my background, a lot of it's within the hospital. I actually started a nursing career path first and then transitioned into social work. So I was actually
Oh.
working on the orthopedic floor of the hospital. And what was pivotal for me is I had been doing that job a long time, working in that role. And then I was put in a 1-to-1, which is like just direct care. Someone's in the room, especially if someone's on a mental health hold or so forth, to keep them safe.
Mm,
And so I had a 12-hour shift. I was in a 1-to-1 and I was caring for this patient that was catatonic, a female that was catatonic. So not a whole lot of response at all to interaction or even like painful stimuli.
mm,
And I found it fascinating. And during my 12-hour shift, the psychiatrist came in and the social worker came in to do their assessment and how they were just their clinical expertise on how they met this person where they were at was just fascinating to me.
mm.
And so that's when I started just exploring like what would that look like for me in that setting? And honestly, I thought I would be in the hospital forever. I was
Uh-huh.
there along my mom was actually in the same hospital working as a nurse manager for 45 years.
Oh,
So I
wow.
thought I was gonna be a lifer. So
Yeah.
um so lots of shifts along the way, but that was a really pivotal moment for me on just how they could meet this patient where they were at. And how they would take in little cues even in this patient's catatonic state
Wow.
to get them the help that they needed. So that was a very pivotal moment in my career path and how I chose to go into social work and mental health. I went into case management. When I switched my degree, I went into, got my bachelor's in social work first, went into case management for the hospital, worked in setting up care plans, discharge plans,
Mm.
meeting with patients and families, working with hospice, a lot of different areas, like real full exposure to every population, every area of the work. And then
So,
when I got my LCSW, I specialized.
oh, cool.
Um, and that's when I really got into women's health. And
That's
at this point, I
amazing.
was still, busy with my family on the outside of things. Um, and worked on the birthing center, the postpartum unit, and then really specializing in the neonatal intensive care unit. And this is where I really got to start to utilize more of my clinical skills and the therapy skills in that setting and meeting
Hmm.
patients in some really vulnerable stages.
I bet. Wow. Yeah. So how long had you been practicing as a nurse before that experience where you started to really consider mental health?
So, short period of time, I was a CNA going through the nursing program, And then it was like right after that, I switched. It was
Oh,
like, okay,
wow.
well, I just spent, 3 years in
Yeah.
this, and now I'm going to completely switch to that. So career change,
Wow.
I'm like, I get that completely.
Yeah. So did you
Yeah.
have to go back to school? You said you switched your degree. Like, were you still finishing, or what was that? What did that look like for you?
Yeah, so I switched over to CSU at that point, and then I some credits transferred, some didn't because it's different programs, different schools. And then I went and finished my BSW, and then went back and got my MSW from CSU as well. Taught at CSU during some of that time,
Oh, cool.
as a graduate teaching um,
Was all
assistant
of that
too.
That's
So
awesome.
was all that
yeah.
pre-kids?
They're all mixed in there, to be
Oh, wow.
perfectly honest.
Wow.
So I had Pierce when I was 23.
Okay.
So my oldest is 14. I
Okay.
had him when I was 23. So I had him while I was finishing my bachelor's in social work. It
Okay.
was like
Okay.
the last little bit of that. And I remember my mom, I showed up because I needed to take a final 2 days after I delivered.
Wow.
Oh
And
my
my mom's
gosh.
circling the parking lot
Jesus.
with the baby in the car.
Oh my
No.
God.
Oh my
I'm like
gosh.
scrubbed out, hair in a bun, like jogging
Wow.
pants. I'm waddling in with like my hospital diaper on,
Oh my
all
gosh.
the things. And I'm like, I just
Yeah.
gotta take this test. Like,
Oh my
Two
I gotta get
God.
through
days
this.
postpartum?
2 days postpartum.
Oh
Jeez.
my God. You barely probably just got out of the hospital, like checked
Yeah.
out.
I think I discharged like either that no, I discharged the
Oh
Oh
previous
my
my
night.
God.
gosh. That's
Wow.
Yeah.
wild.
And sometimes I think I can't handle something like when I
I
have
know,
two
right?
grown kids, and I'm like, oh, if you could do that, if you could take a test in a diaper, then I guess I could explore something.
I think I was probably still delusional and so sleep
Yeah.
deprived that it was
Oh
just
my
like
God.
move forward,
Just
right?
going with
Keep
it. Yeah.
going.
Yeah.
Yeah.
Wild.
Wow.
Man.
So then you have 3 kids total, correct?
Correct.
Okay. So you had
Correct.
them.
So they're all mixed in, and
Yeah.
I worked full time while going to school at any point at the hospital, whether it was in my previous position, continuing my bachelor's in social work, moving on to my master's in social work, and just transitioning roles at the hospital as I went and I
Man.
Mhm.
grew.
Yeah.
Yeah.
That's
So Lauren, we
incredible.
have no excuse.
I know. We're
So
like,
what are
"Oh."
some so as Lauren has felt this call or kind of this pull toward if I want to do something else, that's where she's kind of leaning.
Mhm.
She's been listening to some different podcasts just to explore what kind of personalities is this good for? Where do I fit in? And then she's done some research on how she can get some uh free or affordable training, and so she's found some you can do hotlines that she could be trained to do. What are some other things that
Yeah.
you
Yeah.
think for someone just now wanting to explore, she's not sure, obviously, well, I'm speaking for you, Lauren, but you're not
Yeah.
positive this is what you want to do, but if you want to explore it to see what fits, what kind of things do you think she should look into?
Yeah,
Yeah.
exactly.
So
Well,
the
just to
hotlines are great. Like, I'm glad you're
Oh, yeah.
exploring that. I think when it comes to mental health and especially a career shift, what's your passion? Like, what really
Yeah.
drives you? If you're looking for a career that is more of I love the work I do, I want to show up to do this work, what population are you passionate about?
Yeah, that's a great question, and it's funny, I spoke to another friend who's a psychologist, and she kinda asked the same thing as a narrowing question of "Well, what population do you care the most about?" And I think, adolescents, young kids, kids, I think also, families with addiction issues are also really passionate and close to my heart because I have some experience with that. And without going into all of my own
Yeah.
personal brand of experience, those kind of things I'm passionate about just for because I have, that kind of history. And then also the just women and motherhood transition, I think was something that obviously I also have a personal experience with. But that was so impactful for me to have that kind of therapy at that point in my life. So yeah, I think help starting to narrow in on those fields, and I think or the populations, it sounds like might be a really smart way to go about it because mental health is such a broad. I mean, there's so many broad avenues. Um, so it sounds like that might be a nice way to filter down.
Yeah.
If you agree,
Well, and
Nikki.
you had mentioned an LCSW
Yeah.
because there's so many different career paths for social workers. whether it's
Yeah.
advocacy, whether it's grant writing, whether it's therapy, agency work. You can go into so many different areas. So making sure, like, if you do want therapy, and that's kind of, I want one-on-one interaction with
Mhm.
individuals, I want to watch individual growth. And I think absolutely. And I think there's a huge piece that comes from our own experience. And we have to make sure that we've done our own work first. And
Yes.
so knowing that your path is like, I definitely have some family background within addictions and life transitions around that, then yep, make sure you've done your work on that first. You can show up for someone else and not be triggered in those moments.
Right.
And I
That
work
makes sense.
with that. I bring up at least one student every year, if not two, and we work a lot in that, and making sure that we're not triggered, making sure that we're the best fit for the client, and that we can always meet the client's needs, and it's never
Mhm.
our own stuff that comes into session. So being aware of that, and I'm right there with you. Like, my own mothering experience for sure too brought me into women's health, and I wanted to serve. I see my own therapist. I've seen my own therapist since I was postpartum with Pierce. I've been with the same one. So
Mhm.
Wow.
I mean, she knows me very, very well. She calls me
Yeah.
out my shit all the time, like all
Right.
the things. And it's so important that we have that care and that
Mhm.
Yeah.
background, and then narrow in what you're passionate about.
Yeah, absolutely. And it's so funny that you said that. One of the things I had read and learned was, hearing therapists talk about how so much of becoming of learning to become and the training and the education of becoming a therapist is doing your own work. And so it's interesting hearing you say that. How much is that what you experience, and how much of that is surprising for people, or is it different maybe than what people expect to, like, on the education and the training side? Is it so much more personal? Or how much of it, I guess, is personal in terms of, like, your own reflections and
Journey.
yeah.
I mean, yeah, I think there's a ton of experience-based learning when you become a therapist, and a lot of it is off of what we're passionate about, and that's who we want to serve. And so I think a
Mhm,
lot of education and a lot of work is around that, and making sure that you have good boundaries, that you know how to protect yourself going into sessions so you don't carry someone else's stuff. All of my
Mhm.
mhm,
students,
Yeah.
and honestly, clients too, I'll be like, what are you carrying that isn't yours? If
mm,
you're a really big empath and you happen to attach to emotion and energy quite a bit, then you kind of need to reassess yourself at different points throughout the day of like, what are you carrying that's yours? And what are you carrying that's someone else's? And how do
mhm,
you release it if it isn't your own to carry?
Wow. It's
mhm,
that it kind of was like, making me think like, in your opinion, do you think there are certain personality types or certain people that it's not a good fit for? Like, I was thinking in my mind, I was thinking of an empath, but I guess you do need to be empathetic to like
mhm,
to counsel someone. But is it, if people can't separate that? I guess like you wouldn't know until you start doing some training on that, right? Like to find out, oh,
mhm,
maybe this isn't a good fit for me.
Yeah, well, and I think it's learning skills. To be perfectly honest, I think even if you're a strong empath, that doesn't eliminate you from being a great therapist, because you can
Hmm.
also be a great therapist. It's learning your own skills on how do I show up and make sure it's always for the client,
Hmm.
mhm.
and also do I protect myself, that I'm not taking some of their emotions with me, or I'm not trying to carry it for them.
Gotcha.
And you learn skills along the way. I actually have someone who I take care of a lot of providers in the community too.
Hmm,
And so I have someone that, like, before their shift, we do like cleansing rituals after the shift, before the shift, going in to like prepare yourself for a day. And this individual visualizes putting on armor, like
yeah.
war
Whoa.
armor, of
Huh,
like, I
Yeah.
put on my armor every day and like go through to
Wow.
protect myself into my sessions, and then
mhm,
I leave it at the door. The
Wow.
second that office door shuts, I leave it all there, but I leave all of that energy that isn't my own there too, so I can transition back into my home
Wow.
for
mhm,
my.
That's
So
so
it's like
yeah,
cool.
learning things that work for you, that protect you in
Hmm.
those
yeah,
roles, and still so you can show up with that empathy, with that compassion.
mhm. Wow,
Man.
yeah, I can see how I feel like so many of those skills also translate to just life
Hmm.
and, you know, being like
Yeah.
strengthening your ability to be just so much more self-aware and boundaried and
Hmm.
managing yourself, right? I mean, it's a bigger picture skill also, which makes
Yeah.
sense, but
Well, and Nikki, do you
Yeah.
feel like just as I don't know if it's social media that has done it, but I feel like it's a
mm,
lot of the stigma is gone now from going to therapy. Is that something that you see, or or is that not really something you've noticed? But to me, I feel like everyone should go to therapy as someone who's never been. But like, I feel like it's no longer like it's not like I'm not going because I would feel
mhm,
ashamed of it. But I just feel like there used to be more stigma attached to going to therapy.
I think we're making progress. I think there's still a lot of stigma out there, and especially for certain populations
Okay.
too. I think we still run into multiple barriers, and we
mhm,
still have a lot more work to do to normalize therapy,
Hmm.
to really encourage people to utilize it, and then also finding the means to get people there.
Okay.
yeah,
Whether it's insurance barriers,
Hmm.
deductibles that they can't
Right.
pay,
Or, like,
lack
being
of
able to do it
coverage. The
on like, face to face, like, on Zoom or, whatever
virtually.
virtual, yeah, that's what I mean. Because like, I know a lot of some of the excuses I've used for not going is like, "Where am I gonna find the time to to take a trip out there?" But, with my kids in school, like, I think having virtual options is obviously getting rid of some of those boundaries, but,
Mhm,
um,
Yeah. Well, and that's honestly one reason why we do like at my practice, we do ecotherapy because I'm like, I'm never going to tell a mom no
yeah.
that you
mhm,
can't come if you have to bring your kids. Absolutely not. We'll figure it out. Like,
Mhm.
I will
yeah.
wear a baby, you will wear a baby. We will be on the trail, we'll be at the river, we'll create
Yeah,
something to make it fun for them so they
Mhm.
still feel supported and we can still have positive interaction and work through some things, right? Some
Yeah.
things, depending on age appropriateness, we might not be able to go into deep trauma, but
Mhm.
I can definitely help build skills
mhm,
still with kids present. And it's good for them to see their parent learning
Yeah.
skills and taking care of themselves. It's a great modeling example.
Yeah.
So
right,
we try to encourage that and try to remove those barriers of like, we'll figure it out. Like,
Yeah.
yeah,
I just want you to get there. If we go virtual, if we're outside today, make sure you bring warm clothes for the kids if it's
Yeah.
cold, and we'll go walk on the trail or we'll go sit by the river or do something.
Yeah. Maybe this would
yeah,
be
that's
a good
awesome.
point actually for you to talk about your practice and what you've built and
Yeah,
because I love what you're trying to build the all encompassing with all the multiple providers. I think if you could talk a little bit to that, I'd love to for everyone else to know more about your practice, inner shell therapy.
Sure, sure. So I love a collaborative care model. That is really where my passion is at, coming from a hospital lens where I put together care conferences for substance exposed newborns and making sure we've got all of the right people involved. I also help facilitate the cleft palate, cleft lip clinic out of outpatient therapy services for kids, where we actually set up families in the room. And then five of us providers rounded on the family so they could get five appointments done in one setting.
So
And
cool.
we brought the providers to them in one safe space. And so that's a lot of like where my ideology and background of trying to build this collaborative network
mm,
in one setting comes
mhm,
from. But I partner right now with a woman's place, which is a absolutely incredible midwifery practice here in town,
Mhm.
that has a lot of the same goals of really taking care of their patients, giving them the time that's needed. It's not like a primary care where you get 15 minutes, you only get
Mhm.
one thing. No, those
mhm,
providers sit down with you and make sure that they have a good chunk of time, at least like 45 minutes to sit down with each patient to get to know them and really address any concerns. And so we have this collaborative care model there. And then my practice, we have four therapists working at my practice right now. And then we partner with two different psychiatric nurse practitioner practices too that come in to see our patients there,
mm,
and provide medication management. And
mhm,
so that's kind of the start and our groundwork of it. We're working on expanding that as we find the right providers that really align with my ideology and also with Jessica Guthrie, who's the owner of A Woman's Place's perception on what care should look like.
mm,
So as we continue to find those people in the community, we want to bring them into that space and create that safe space. So I also just created another, we're working on a 501(c)(3) to receive grant funding. And I have a
Oh, cool.
partnership right now with Operation Kids out of Salt Lake City that I can get some grant funding through them to start building my own 501(c)(3 so
That's
we can remove some of those barriers of care.
that's so
That's
cool.
amazing.
And
Yeah,
you were saying, like, I
that's
know
so
I've
cool.
I've asked you in the past, just in our meetings, like, ideally you would like to have what are the other providers you would like to have all in one place?
Yep. So lactation consultant. I love No Code Doula Collective, but they're kind of growing and doing their own thing. But I'd
Hmm.
love to have a doula in that space that we
Mm,
already partner with. I would love to have a pelvic floor physical
mm,
therapist in that
Hmm.
space. Um, what else? Possibly a chiropractor in that space that really specializes within the same population.
Hmm.
mhm.
Um, really massage therapist also
Oh yeah.
working on other aspects of care and self-care, and it's
Hmm.
all set up in one space.
That would be so
I
nice just
just
to be able to
think
go to
Amazing.
one, yeah, just to one place to be like, someone help me. Like,
Yes.
I have various ailments.
Yes.
Someone
because
help
all
me.
of your providers are there in
Yeah.
one space. You
Yeah.
already know them, you already
And they
feel
all know each
safe.
other.
And
Yeah.
they know each other.
Yeah.
It's
Yeah.
Yep. And
critical.
we take care of it. So any of my clients that already collaborate with whether it be one of the psychiatric nurse
Hmm.
practitioners, whether it be a woman's place, we have them, if they're open to it, sign a release of information so we can collaborate
Hmm.
Mm,
to also try to so we're not missing anything. If
Yeah.
I know something and that patient didn't tell Jess and I'm like, "Hey, Jess, I think I see this. What are you seeing?" And
mhm.
then we have the psychiatric nurse practitioner, "Hey, I think this med could be really helpful. What do you guys
Yeah.
think?" I'm going to bring it up. We can collaborate in those ways and
That's so
have
Yeah.
cool.
multiple eyes on the patient to prevent
Yeah.
Yeah. That's
anything
so
from happening.
awesome. That's the
Yeah.
experience I had when I lived in Madison. So I moved here to I'm in Portland, Oregon, and I moved from Madison, Wisconsin. And at my both of my kiddos were delivered by a midwife, and it was so similar to what you're talking about. So they were a midwife practice that was within a women's health physician's office, so they were joined, and so it was a collaborative model, and so I had my midwife that delivered both my kids, then she was so insistent and educated me on like, "Hey, I'm also here to give you whole woman care, like, it's not I don't just have to deliver your baby, like, for all the stages of I'm basically your primary care provider or can be. And then they had nurse practitioners on staff who could come in and help. And it was kind of a dream because
Yeah.
I could have this whole model and everybody was within the same office. And I have yet to find that again. But
Yeah. I
please
know because we
create
were
it more,
Nicole,
more.
Nikki, we were talking about like how we feel like we need like menopause midwife.
Yes.
Like we need someone to like hold our
Yes.
hand through this like a therapist. I need dermatologists to tell me what I'm supposed to do.
Hormone.
I went to my
Tell me
dermatologist the other
about,
day and I was like, I have some age spots and I'm asking about
yes.
skincare, but instead she was like, oh, just go get that lasered off. And I was like,
That's
that's
what
not,
mine
yeah. I
said.
was like, that's not what I was asking about. Like I
I was like,
want,
"Can you look at this and this?" And
yeah,
he was like, "Yeah, you just
you just
go
get it
to a
lasered
med
off.
spa. Like, go
Yeah.
get it lasered." And I was like,
Yeah.
"So is
And
it
I was
just
like,
age?" And he's like,
I know.
"Yeah."
I was like,
I'm like, "Oh, cool."
I want like someone to
Oh,
tell
very
me,
good. Yes. All
here's
right.
yeah, it's like here's the skincare that you need to be doing. Here's like
Yes.
here's the vitamins you should be
Nutrition
taking. Here's
and
yeah. And it's like,
supplements and hormones and
but I know
all of
you
it.
said that
Yeah.
you're open to talking about, mental health and perimenopause and what things we can prepare for and what is happening inside our heads right now as we get to this stage of
Ugh,
life.
Yes,
wild.
yes. Well, and I love the midwifery practice that I partner with, Women's Place. They absolutely
Yeah, and I
see
go
women
there
at all
because
stages
yeah,
of
you
life.
told me about them. So I go there.
Yes.
I love them. Like she
They're so
tested
great.
every single hormone imaginable for me, like
Ooh.
not just the regular ones that doctors do. Like she was like, "All right, we'll get your insurance to cover
Mhm.
all these." And she did. And so that was just to say like I go there and I love them and I understand. But yeah, if you want to talk more about I totally interrupted you
Yeah.
there.
No, no, they're wonderful. And that's what we need, right? We need someone that can walk alongside us during our life within the context of changes and
Yes.
transitions.
Uh-huh.
I mean, man, you guys are gonna get me on a tangent. This might need to be like a series.
That's
I don't know
fine.
that I can get
Yes.
through it all. Because I think it's so important that we talk about women's health and also that we've come a long way within research, but really researching women's health just started in the late 1980s,
which is
That's
wild.
wild.
which isn't that long ago. I was like, I
Right.
was born in it,
Right.
Yeah.
Right.
so I mean, we still have a lot of work to do there and making sure that we understand the differences of how hormonal shifts affect women.
Mm-hmm.
And that it's there also just from when we're growing up, we've got those shifts going into puberty and how that affects our brain and our body. And then
Mm-hmm.
we are come to childbearing age and we've got another big shift in
Mhm.
hormones and how it
Mm-hmm.
affects our body. And then it's like, okay, and now we're in this perimenopause where it's like,
Mhm.
whoa, so
Mm-hmm.
many changes are happening and so
Mhm.
many shifts within hormones and neurotransmitters are happening in our brain that are really affecting our daily living.
Mhm.
Mm-hmm.
And so I think it's so important that we learn our bodies and we talk to kids, like our girls, as they grow up. I want them to know more about their actual cycles and what's happening within their brains
Mm-hmm.
during them.
Mhm.
Because once you start to know them, you can start to track them, right?
Yeah.
Yeah.
While your cycles are still happening. Once you get to perimenopause and things shift, it's irregular.
Mhm.
Everything's
Right.
kind of erotic in the way of like we can't
Right.
pinpoint
Mhm.
And you,
Yeah.
what time in my cycle I'm in to know
Yeah.
if I'm going to feel next week, if I'm going to feel like crap next week, if I'm
yes.
going to be raging next week,
Yeah. Yeah.
like all of the things.
Right. And you spend your adult life kind of figuring out your own patterns, and then you
Yeah.
can predict like, oh, well, now, oh, I know what's going to happen tomorrow, and I know how I'm going to feel, or I know this feeling I'm having is related to this. But then to your point, everything is so shaken up. I was just having this experience personally.
Yeah.
I was like, is this because of, I was like, wait, what day is it? And I'm looking at my calendar. I'm like, I don't know anymore because
Yeah.
everything is so like messy
Gosh.
that I don't even know what's happening. And then there's so many, I think it's so interesting what you're speaking to about how your brain changes because maybe women
Mhm.
don't know that. I certainly don't, but like,
Yeah, we just think it's a physical thing. Like,
and hormonal, right?
yeah.
But like, what does your brain actually change through perimenopause? And what does
Mhm.
that look like? Or what might people not know about that?
Yeah, yeah, absolutely. And I think, that's where even knowing our cycles and what's happening in our brain during our cycles, because estrogen, progesterone, GABA, I mean, all of glutamine, all of these things affect neurotransmitters at different
Hmm.
times, depending on where the levels are at. So if we think of low estrogen levels, they're also reducing serotonin. Well, serotonin is what helps us feel stable within our mood.
Mm-hmm.
So if we're losing estrogen during this time in life, we're also having lower neurotransmitters
Mm-hmm.
moving through our body that helps regulate mood. So we think about that neurotransmitter. We also think about dopamine. And estrogen also influences dopamine. And dopamine is our neurotransmitter that helps us feel motivated, have energy, have focus,
Mhm.
all of those things. And then we think about norepinephrine too. I really love neuroscience, so I might
Yeah.
get on a tangent. You might have to stop me.
No,
But
it's okay.
norepinephrine is a neurotransmitter as well, and that's more attached to like our fight or flight
Mm-hmm.
response.
Mhm.
And when that's imbalanced too, are we constantly in fight or flight and not knowing how to respond?
Mhm.
Also affecting our memory
Yeah.
in our
Mm-hmm.
hippocampus, in our
Yeah.
brains. And so our short term memory is affected.
Mhm.
And so
Preach.
it's all related
Yep.
back to these
Yeah.
hormones of these neurotransmitters and how they
Yeah.
move. And then we also have to think of like receptor sites and where those exist in our body. And,
Yeah.
we talk about a lot in mental health, the mind body connection and
Mm-hmm.
the gut brain, right? So 85 to 90% of our serotonin neurotransmitters are in our GI tract.
Oh,
And
Huh.
so if you don't
interesting.
have a healthy gut either,
I didn't
then
know
are we
that.
able to
Yeah.
absorb and actually attach to that neurotransmitter the way we need to in order
Wow.
to
Interesting.
feel good and feel like we can manage our mood?
Okay, so
Mm-hmm.
does it get to the point where,
That's
like,
wild.
if I'm, like, understanding, "Oh, my it's because of my, I feel unstable because of my neurotransmitters, whatever. Then are you like, then can you stabilize or no? Or is it just like, it's just understanding that that's what it is?
Well, no. So I think there's a lot of different things you can do. One, I think by getting to see a midwife, an OB, someone that can support you along these lines.
Uh-huh.
And can we help the transition and the amount of hormones decrease gradually rather than all at once so it doesn't feel like such an abrupt
Um,
change?
yeah.
Uh-huh.
Yes. Right? Can we add different elements there to help you? Could we also work on um, managing kind of those serotonin receptor sites in your GI tract and being able to make sure that you've got a healthy, regular gut that's able to process things
Interesting.
there. There's also ways to increase the neurotransmitters that are more organic behaviors that we can
Hmm.
do. When we think of just how we increase dopamine or how we increase serotonin, we can do that through different diets. We can do that through different activities.
Mhm.
I also have ADHD, and so I am always seeking how I increase my dopamine
Hmm.
and
Mhm.
my norepinephrine. And so I go to the gym regularly. Exercise gives me dopamine, norepinephrine, and endorphins.
Hmm.
And so that
Mhm.
helps me feel focused. That helps me feel energized each day. And it's also helping restore some of my muscle mass because during perimenopause, because of the
Yeah.
decrease in these hormones, we're also
Right.
feeling like, ooh, my muscles feel different. I don't feel as strong
Hmm.
when I'm
Mhm.
doing activities. And so trying to find activities that'll help increase those neurotransmitters in
Right.
Yeah.
different ways as we're losing the hormones.
And weren't you saying that you recently discovered you had ADHD, like through it was because of like perimenopause, or what was it? What was the link there?
Yeah, well, so trauma and perimenopause at the same time. So some big shifts. And this therapist that I've seen for years knows me really, really well. We were like, we've been stuck on OCD forever. We're like, no, you have OCD, like for sure. And I
Okay.
mean, anyone who knows me at the school, who knows me in life is like, yeah, that fits. Like you are very type A about weird shit. Yep, got it. Um, but what we found is I was like, man, I just don't feel like my prefrontal cortex is doing what it used to be doing for me. My
Mhm.
focus is off. I cannot sit down and read a book like I used to. I can't do a bunch of things that I felt like were changing. And so
Mhm.
she's like, well, there's also some significant trauma too. So I was like, is this trauma induced? Is this perimenopause and hormonal shifts? Is this other things? And she's like, let's try a little bit of Adderall. Let's just see if we give you a little bit of a stimulant, what you do on it.
Yeah.
And so I was like, okay, I trust this person. She's
Yeah.
known me for so long. I was like, okay, let's see if it'll help. And she's like, and it could just help reboot some of your cortisol levels too,
Mm.
because I was running at a very stressful rate for a very long time, whether I was working in
Mhm.
trauma in the hospital or dealing with trauma within family stuff or so
Mhm.
forth. And at that point, your body gets used to high levels of cortisol. And then
Mhm.
sometimes it doesn't produce it. And so
Hmm.
you do need some cortisol in order to function and feel some energy too.
Mhm.
So she's like, let's try it. So I took Adderall and I took a 5 hour nap.
Oh wow.
Wow. It's
Like,
amazing.
and then I brought it back to her and I was like, so I don't think it did what we wanted it to do.
Let me go night night.
I was like, I laid down on the couch and I was out for like five
Yeah.
hours. And
Yeah.
that is never my norm. And
Yeah.
she's
Wow.
like, so I think we need to reevaluate what we've thought has been going on in your brain for the last 15 years.
Oh my gosh.
I was like,
Wow.
yep. And I was like mind blown. I was like, what? I don't have OCD.
Yeah.
And she was like, no, 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 that still exists. She was like, but I think you've been so high functioning within ADHD your entire life,
Mhm.
which a lot of women present
Yeah.
that way,
That's
that
yeah.
OCD is actually your coping mechanism
Oh
on
Yeah.
how
wow.
you've been able to manage your ADHD the majority
Oh.
of
Oh,
your life.
Ugh.
I have so
This
many
is Lauren has
thoughts.
so many thoughts because I know Lauren has been
This is a
just
similar
recently,
journey.
yeah,
I
discovering that she
know.
might have ADHD, and it's
Oh,
like,
say less. Bring up ADHD and I will just go off on no. So I have been on a similar path, and it's so interesting because I feel like the more I learn about ADHD, so many of those symptoms are similar though to like what also perimenopause could be
right.
causing, right? Like all of a sudden I have no short-term memory. I have no working memory. I've always had there's some symptoms I have themes of my whole life, but then there's some symptoms that seem to be getting worse now, that maybe I haven't experienced before. And there's so much overlap that it's so hard to be like, well, I'm
Yeah.
40 years old. It could be perimenopause. And also perimenopause, we learn,
Yeah.
right, can be 10 years long.
Mhm.
So
Yeah.
some people want to say like, well, you're only 40. I'm like, yeah, but like, and I have some history of women in my family hitting menopause on the early end. So anyway, all of these things overlapping, it's like, what's what? And that's so interesting, your story about working with your therapist and just trying medication, because I've also read and heard that medication stimulants for ADHD are like one of the most effective psychiatric treatments, medicines that, like, if you have the disorder, it's a super effective drug. And so it's interesting. And I've heard that from other psychiatrists to say, like, well, just try it and you'll know instantly. Like, it
Yeah.
will work instantly. So I wonder, it's just so interesting that it could be a path for diagnosis, essentially.
Yeah.
Like, I'm curious, your thoughts on that. And also I feel like there's this, sorry, I'm rambling, but there's this whole, I feel like ADHD has almost become trendy because it's become so much more, um, in the news and in the awareness and in the,
Mhm.
conversation culturally,
Yeah.
that there's almost this stigma of like, oh, you don't have ADHD, like you've
Yeah.
just been on social media too much. You've just like
Yeah.
convinced yourself that you have it.
Sure.
Right.
I'm
Sure.
curious
Well,
your thoughts on that.
yeah. Well, and I think the way I approach any mental health diagnosis is I have to put a diagnosis on someone's chart for insurance purposes. However,
Right.
we're treating symptoms. And so it's more about individualized paths on
Mhm.
what symptoms are presenting, how long those symptoms have been there, and how it's affecting your daily living. And that's always our goal. And you're right, there's
Mhm.
tons of overlap when we think of trauma affecting the brain and
Mhm.
neural pathways in the brain that are affected by trauma. They show up as ADHD,
Mhm.
Mhm.
right? We think
Mhm.
of generalized anxiety disorders. And a lot of
Yep.
times, a lot of women are misdiagnosed with generalized anxiety when maybe they have had ADHD. They just didn't have the external busyness. So the twitching, the fidgeting, the movement needed because it's all internalized rather than externalized.
Mhm.
Mhm.
And so it's more about the thought process and also OCD, right? There's so many overlaps within these diagnoses. And then you reach perimenopause, and I'll tell you, it's going to exacerbate any mental health diagnosis,
Yeah.
no matter if it's depression, anxiety, ADHD, anxiety disorders, a mood disorder, personality disorder, doesn't matter. It's going to be exacerbated because of all
Great.
of the shifts in your
Great.
hormones that
Super.
you've been trying to regulate for so long.
Yeah.
Right.
And it's like, I finally
Man.
got a handle on it, and now everything shifts again
Right.
Man.
That's so wild.
This is so unfair that men don't have to go through this.
So unfair.
It's so unfair.
completely.
Oh,
Ours is
oh
ever
man.
changing. I'm like, so when do
Yes.
you have to change? You
Yeah.
get puberty, right?
Yeah. That's
We
Right.
it.
all go through puberty at about the same time, and those are big shifts for all of us. Where's your other changes?
Yeah.
Because I feel
Where's
like
all the
we go
rest?
through like 5 or 6.
Exactly.
Right.
Oh
Right.
man.
That's so wild. So
Yeah.
what's the best way? Okay, so if you're a woman in our age range who's experiencing this and you're learning, you're reading online, and you're kind of like we are, we're like, is it? Is it
What do we do?
perimenopause? Is it
Yeah.
ADHD? Is it depression? Is it anxiety? Also, we're living in this world
Yes.
where the
Everything's
world
volatile.
is stressful and
Yes.
volatile, and we're all modern living in on islands. We're not living in community like we used to, which is a whole,
Yeah.
I could do a whole
Yeah.
rant on that.
Mhm.
Where to start? Like, is it just
Yes.
finding a good provider? Um, you know, how do we sort through all the confusion?
I think finding a good provider that can address things for you and really sits down and listens to you. When
Yeah.
I think of addressing things, I really like to focus more on those symptoms and how it's affecting daily living. So the first thing I do is, yes, start to look for a provider. You probably need some sort of midwife, right? Or someone that can help you navigate transitions within hormones.
Uh-huh.
And then you also need to find maybe a therapist to work through things. Um, and and just to navigate that. And then I'd start watching patterns in daily living. That's
Hmm.
usually where I have most of my clients start is like, we just need to see what symptoms are present and how they're actually affecting you. I know you don't feel good. And I know
Mhm.
you want to feel better. And I want that too. So to start evaluating it, start kind of journaling throughout your day of like, what are you feeling at different times of the
Mhm.
day and what's affected in your daily living activities.
Mhm.
So if
Mhm.
sleep is consistently affected, you're like, man, I used to be able to get energy off of 6 hours of sleep, and now
Mhm.
I need like 8 to 9 hours, and
Yeah.
otherwise I don't function. Right?
Mhm.
Make sure that you're documenting that and you're identifying what you're doing before bed. Are you waking up multiple times in the middle of the night? What does that look like?
Right.
Also throughout the day, are there times of the day where you're exhausted or you have rage? A lot of women in perimenopause go through rage
Yeah.
at
Mhm.
different times of the day or different times of the week where they're like, when I've met my capacity and I cannot take in any more stimulation, I can't
Mhm.
take in any more information at all. I'm like, I'm just done. I'm
Mhm.
maxed out.
Mhm.
Then rage comes.
Yeah.
Yeah. That reminds me, Lauren, of your
Of
back
you
to school
last
week
week.
when you were
And
oh,
you last week.
I was gonna say you.
You
Yeah,
had
when
this
you were like, "I'm up here and I
I'm
can't
stuck
come
here.
down. I'm
Yeah. I
just,
was like,
like,
I'm stuck
stuck."
right here. Yeah.
Yeah.
But then, like,
Yeah.
where I was, like, stuck there, I know you talked about how you froze and you were like, I'm just gonna
I shut down.
she shut
Yeah.
down. And she was like, I'm just gonna go sit on the
Sometimes.
couch for hours, like,
Yeah. Yeah. Not
because you
all the time,
couldn't
but I'll go into shutdown freeze modes where I just, like
Yeah.
that's my stress response is I kinda, like,
Yeah.
go down.
Yeah.
Yeah.
Well, and a lot of times that's a learned behavior, probably more
Yes.
from a childhood response to something. Is as a child, you probably couldn't express your emotions or couldn't talk about things. So
Yep.
instead, you had to internalize it and shut it down and
Right.
sit in it.
Mhm.
And so that's a learned behavior that we resort back to at times. And so
Mhm.
sometimes our response, especially when we're like at our max, our capacity is met, we revert back
Mhm.
to some of those known behaviors that are protective.
That's
Yeah.
And so
interesting.
whether, like fight or flight,
Yeah.
right? We think of that fight, or freeze.
Okay.
And
Mhm.
so if you're a fighter, you go to fight and you go to rage,
Yeah.
Yeah.
right? You go to you're one that just needs to like remove yourself. You're like, peace out, and I'm
Mhm.
gone.
Yeah.
That's how I
Time
am.
out.
You're the person
Yep.
who like
Break.
goes to everyone and just like
Yep.
exits the room,
That's me.
and like it's like you can't find them. Where have they been at for
Yeah.
like 2 days?
Yeah.
Yeah.
Or you're the freeze.
Yeah. That's
And
what I
that's
do.
when you internalize and you shut down.
Yeah.
Interesting. Man.
Well,
But
I
I think
think that's oh, go ahead, Lauren.
No, you go. You go.
Sorry.
It's okay.
Um, I forgot.
Like that short-term
Speaking
memory is
about
gone.
symptoms, it's that
Yeah.
short-term memory.
No, I was just gonna
Oh
bring up
gosh.
something that, like, I think, Nicole, you helped me realize this, was that, like, so what you talk about trauma a lot, and to me, that means, like, you've gone through some shit, right? Like, I have very little, like, I don't feel like I have any trauma. Even in my childhood, like I feel very blessed that I didn't have these kinds of traumas. And so, like, I know I've talked to you about my sleep issues, and you were like, "No, it's probably trauma." And I was like, "No, I don't have any." And you were like, "No, but like when you're trying to go to sleep, are you thinking about like I won't be able to go to sleep if like, are you worried about not falling asleep and are you stressing about that?" I'm like, "Yeah." And you're like, "That's trauma." And I'm like, "Oh, I hadn't like." So I think also just renaming or like re-identifying what trauma is can help people like realize that like, oh, I can seek treatment for this. Like, whereas
Mhm.
I've always felt like I don't need therapy, right? Or I shouldn't go, or because it's not because I don't have these, I haven't had a huge loss in my life. I haven't, had childhood drama or anything like
Abuse
that.
and
And so, but I
yeah,
think like just redefining what trauma is, that it doesn't have to be this huge, like
capital
massive
T
loss or,
trauma.
yeah,
Yeah.
exactly.
Right. Well, and it's how it's appearing to you. When we talk about sleep and being sleep deprived for an extended amount of time, and then now developing these symptoms of like PTSD around sleep, where it's
Yeah.
like I'm scared for nighttime
Yeah.
because I know I'm not going to sleep, and then it's
Hmm.
going to be excruciating all night, and then I'm
Yeah.
going to get up and be exhausted and have to do the same thing over again.
Yeah.
And I have flashbacks of me just laying there trying to fall asleep and being so frustrated
Hmm.
without any resolution for months on
Mhm.
end.
Yeah.
I mean, you think of like developing those patterns,
Hmm.
and then it creates this fear and it creates this feeling in your body
Hmm.
before bed every night. And
Yeah.
so when you think of like how things affect you and how you're holding on to them in the brain,
Hmm.
those are identifying within trauma symptoms of like, no,
Mhm.
I am fearful for bedtime now because I
Yeah.
know I'm not going to get sleep again.
Yeah. Man, that's
Yeah.
wild. When you said that to me, I was like, I was just like, "No, I don't have
Blew your
trauma," and then I'm
mind.
like, "Oh, I have a lot of sleep trauma." Like, the panic
Yeah.
of not
Yeah.
being able to sleep and then having to do the next day, like, having to take
Mhm.
care of the kids and do whatever work I need to get done with no sleep is, like that is so
Y
terrifying to me that I'm like,
Yeah.
I didn't wanna try, so I just, like, rely on medication, which, well, I
Mhm.
mean, works, but I need to
Yeah.
get through I need to work out that trauma so I can get off the meds, but
Yeah.
Yeah. Well, and then you try to find where it stems from because you think of even like postpartum periods where you're so
yeah,
sleep deprived
yeah,
Mhm.
and like your prefrontal cortex is just not intact at that
yeah,
point because it's not working the way it needs to because it's not getting recharged.
yeah,
Right.
When we think about sleep patterns, what research tells us is in order to get to the deep stages of sleep, it takes about 3 hours
wow.
Mhm.
because it's past REM, right? We have REM here
Uh-huh,
and then we have deep REM where we can have these lighter dreams. And yes, we're in REM, but we're not really getting brain recovery until
okay,
we get to that, past that, into the deeper sleep. And so it says 3 consecutive hours is on
wow.
average what it takes for any individual to get a little bit of brain recovery.
Man.
Mhm.
So if you wake up multiple times at night, you're just never getting brain recovery. Yikes.
Yeah.
Because you're never getting those consecutive hours.
Yeah.
And some,
Right.
everyone's brain's a little bit different, but on average, that's how long it's taking.
Wow. Well, sorry we're
That's
just dumping
crazy.
all of our current problems on you, but
Yeah.
we're like, "Ooh, a
Thanks, Nikki.
professional. Here are all my problems."
Man, I can talk about this stuff all day. This is
Well,
like my passion. I
Yeah.
yeah.
love supporting women in our community. It's what I
Yeah.
do.
Love it.
So I
Well,
love it.
it's so validating. One of the experiences I had too with going to therapy in my through my big transitions was like just the context and the validation you get from a professional and somebody who's like, yes, like of course you are experiencing this. You are living this life and you're dealing with all of this and and not to minimize at all what you all do, but like to me that was such a huge benefit of getting care. And it just made me realize that as women, we just don't have that community built in to give us that support
Yeah.
and that context and that validation of like, yes, you're going through it. And like, yes,
Yeah.
it makes sense that it's hard.
Well, because even, like,
um,
like, your friends don't know how to support you through that. Because like, when that happened, when you had
yeah,
just had your baby and then your dad died, like, I remember texting
I
Zach and
know.
being like,
Mhm.
"Can you make sure she's like" I can't do anything from far away, like, all I can do is check
Yeah.
in, but I was like, "Can you make sure she has therapy or is able to get what she needs?" Because I was like, just becoming a mom will just wreck you anyway, and then going through
Yeah.
double trauma was like, I just didn't know how to support
Yeah.
you, so I was
Oh, it's okay, Lauren. I love you.
Love you.
I knew you guys were there for me and I knew
Yeah.
that, it's just it's a wild thing. And for me it
I
was
don't
like
know
going
why
to a
I'm
therapist.
crying, that's weird.
It's
It's
okay. It's
trauma.
okay. It's a safe place. You can cry here.
It is.
Yeah, it's
Um
good. And you can feel safe.
yeah,
That's funny.
exactly. Yeah, it's just like a wild thing and so it's funny because I was really experiencing rage. Like I was a new mom and going through grief. And I was like, I went to therapy because I was like, I'm so angry all the time.
Yeah.
And I feel like I went
Yeah.
to therapy because I was like, I don't want to be. I feel like I'm just so angry. I'm like on the edge of exploding with my kids all the time. And it was just, I feel like half of what she did was like, yes, of course you are
Of
angry.
course.
Like you just lost your dad. You are becoming a mom.
Yeah.
Like, yes. And you've been taught that anger is not okay. And so it's
Yeah.
a really
Right.
scary thing for you to feel angry. Um, but it is okay. Like you will survive feeling angry. And
Yeah.
it's not anyway, I'm just talking at you, Nikki. But like
Yeah.
that's such an amazingly uh it seemed simple, but it was so revolutionary for me. And I just feel like so many women don't have that experience or that, you know, support.
Yeah.
Yeah, absolutely. Well, and I think of that transition in your life, becoming a parent and losing a parent at the same time, and how much that just pulls at you because you want that support as you're learning how to parent. And it's like, I
Mhm.
need that support. I need that person. And I
Mhm.
don't have that person. And I'm mad.
Yeah.
This isn't the story that I was envisioning
Right.
becoming a mom. And I don't want it to be my story. I don't want to accept it.
Right. Yeah, and
Absolutely.
well, don't make Lauren cry more. Lauren, are you okay?
I'm fine. I'm fine.
I'm fine.
I don't know what
Yeah,
my
and
deal
it's
is.
why I think I also it's okay. I also feel like it was like being in the middle of new motherhood. I remember
Yeah.
telling my mother-in-law, she was like, "How are you doing?" And I was like, "I just don't have the luxury to grieve. Like,
Yeah.
I don't have the luxury to sit around and just be sad. Like, so nice for other people." That
Yeah.
was how I felt at the time.
Yeah.
Like, I have a newborn. I'm nursing
Yeah.
5 to 7 times a day. I don't have the luxury to slow down and be sad. And
Yeah.
anyway, it's just such a wild feeling. And they were like,
Ugh.
okay, well, let us
Like,
know
let's
if you
sit
need anything.
down.
Yeah.
Oh man.
But yeah, I think women are always going through it, and just having someone to say like your feelings are valid.
Uh-huh.
Um, because you are going through it, is really powerful.
Yeah.
Well, and we're not supposed to go through motherhood alone. When you think
Yeah.
of any
Yeah.
culture, anywhere in the world, other than American culture,
Uh-huh.
where do they have these expectations that you're supposed to be isolated, suck it up, and be by yourself and learn how to do it?
Yeah.
Like, it doesn't exist. You think of other cultures and other villages and, generations back. No,
Mhm.
there was support there.
Uh-huh.
Right.
And we've gone so far away from that, needing this independence. But
Yep.
then we forget how much we need each other.
Uh-huh.
Absolutely. And, partners, for those of us who have male partners,
Yeah.
like they're great, but
Yeah.
there's
But they're
just some
males.
some limits to like their
Yeah.
male experience, and
Yeah.
you just need other women in your life. You
Yeah.
need your
Yes.
women community, I think. So,
Oh
um,
Yeah.
man.
absolutely. Sorry,
Oh,
Lauren.
I know. I'm like, how many tangents have we gone on now? It's where I'm like,
I know.
I just, but I'm just like, also like thinking back to like that your experience with therapy is what made you think maybe that's
Yes.
what you want to get into. And,
Yeah. Well, yeah.
well, I was just saying, like, Nikki, is there anything from back when you started realized you wanted to become a therapist that you wish you'd known before you did, or is there anything you learned along the way that you're
Mhm.
like, this would have been helpful before I, dip my toe into it, or any other parting advice for Lauren as she
Yeah.
explores
Yeah.
it?
I think I think I wish someone would have told me how important boundaries are in
Hmm.
so many aspects of life becoming a therapist.
Mhm.
Before I went into it. I think it's generational too. I think just watching my students, some of my students have really good boundaries.
Hmm.
And then I look at like the veteran therapists in my office, me and
Yeah.
Jenny. And
Yeah.
anytime someone comes in, I'm like, don't ever look at me and Jenny's schedule. Like that is never the model. Like, don't
Oh.
look at that because me and Jenny will start at 6:30
Oh,
in the
yeah.
morning. And then we got random ones at like 8:30 at night
Oh
and
my
like
gosh.
all in between. And then you look at some of our newer therapists schedule and they're like, I start at 11 and I end
Yeah.
at about 5 every day.
Yeah.
And I don't work Fridays. My Fridays are completely blocked. And I'm like,
Yeah.
oh,
Oh, how
I
do
Oh.
you
could be
do
that way.
this? I
Yeah,
could
it
do
could
Right.
be
that.
And
like
I'm
that.
like, and then I'm a people pleaser. So I'm like,
Yep.
shit. All right.
Yeah.
Well,
Yeah.
that sounded
Maybe
nice
one day.
until I then felt
Yeah.
guilty and started putting people in more spots again.
Yeah.
So
Mhm.
it's just like I wish I would have established those boundaries and those routines early on, as well
Mhm.
as making sure that I had my own therapist in place, which I did
Mhm.
just because I already had that established, but making sure someone has their own therapist in place.
Mhm.
And that they have a good self care regimen that they do regularly and they know what helps them navigate and get through things
Mhm.
Mhm.
is to really explore that. Also, knowing that therapy is not being a therapist. I think there's a misconception that it's an easy job.
Mhm.
And
Doesn't
in
sound
ways,
easy
I
to me.
think there's this flexibility, right? I think it
Mhm.
it provides flexibility, which is so appealing to so many
Mhm.
people. Can you do it virtual? You can do it in office. You can make your own hours. You can do all these things. Yes, but to hold space for everyone's worst experiences,
Yeah.
and that is your daily activity. is to hold
Mhm.
that space for everyone's worst experiences and try to help them navigate through it. Is hard.
Yeah.
Or if you feel like you have someone's life in your hands and you're
Right.
trying to make those clinical judgment calls on, do I send them inpatient?
Right.
Can I keep them safe at home? Have I
Mhm.
removed all the weapons? Have I
Yeah.
done all the
Mm.
things in order to keep this individual safe?
Yeah.
Um, and holding space for that too. That
Wow.
just to be aware of all of the elements that might go into it
Mhm.
and what setting you might want to be at. Because private practice has its pros and cons, right? I came from an agency where I had great PTO benefits, I have retirement benefits, all of those things. You go into private practice, and
Yeah.
yes, you can develop those, but it takes some
Mhm.
time.
Mhm.
And initially, you don't get PTO. So you
Yeah.
have to build it
Right.
into your working schedule and know how to balance it.
Yeah.
Mm.
I
Mhm.
think that
That's
alone
a
is where
great
I'm like,
point.
that seems way too hard. Like that as a career, knowing that, like, did I give the right answers to like this person's not like that feeling responsible for someone's
Mhm.
life is why I'm like,
And
that's not for me.
safety.
It scares the crap out of me. So like
Mhm.
that alone makes me know it's not for me. But maybe it's for you, Lord. Scares the
I
shit out of
mean
me.
I mean, you
You
Yeah.
learn,
learn, yeah.
and this is what I tell my students is I'm like, you're not at a place in your clinical journey yet to really be able to evaluate if I can send them home. We work with moms, so do we ever want to send a mom
Right.
inpatient? No,
All right.
Right.
Yeah.
but always go on the side of safety,
Yeah.
right? And
Mhm.
caution. And if you don't feel comfortable making that call, then automatically send them to get evaluated at the hospital
Yeah.
and then allow someone else to help you
Yeah.
navigate that if you don't feel comfortable with that.
Yeah.
Right. That makes sense. The last question I have for you regarding the career change. I kind of started talking about this earlier, but then I think we got distracted. Classic me. But what if so I've done a lot of learning. I've like listened to therapy podcasts. I've talked to a few
You read
physicians
that
and I
book?
want to I read yeah, I have a book that's like a careers in mental health.
Mhm.
And my goal is to like interview like you a lot of different physicians and practitioners and clinicians just to kind of get more insight into their daily life and what their work is like. But aside from that, I feel like the bridge between kind of like where I'm at and then making an investment or going to school, it's like, is there a way for me? The big question is like, I like the ideas, it all makes sense. But when I get in there, am I gonna like, I kind of feel like it's one of those fields where, especially as a clinician treating people, like once you actually are getting with patients, I feel like that's when you really learn, like, is this for me or am I just gonna, I imagine I'm not gonna hate it, but like, you want to try it. Obviously, you're not going to go around giving unlicensed therapy, but like, are there ways to, I know I learned about the volunteering for a crisis hotline is a
Yes.
really interesting path because they give you a lot of great crisis training. And then in return, you volunteer, you make a commitment to give them a certain amount of volunteer hours to take calls. But are there
Yeah.
things like that you might recommend for somebody who's like, I'm not ready to like go back to school? um, and like, how can you be sure that you want to take the leap? And
Like, are you
are
able to,
there
like,
things you could do to
shadow?
try
Is
it
that a
on?
thing that's available
Yeah.
or no because of HIPAA? Like, is shadowing a thing?
No, you can shadow. You have to do some training first, and I'll tell you, even some of my clients that I've been seeing for like 5 years don't like students sitting in honor sessions.
Yeah.
Yeah.
And so it's hard sometimes. Some of them are great with it. And they're like, yeah,
Mhm.
Sure.
no problem. But some of them don't, and I always leave that space for them to decide because it's
Mhm.
their session.
Sure.
But there are other opportunities in the community. For instance, like we're starting up a new group and we want to offer childcare services. So
Uh-huh.
you get group exposure of the therapists in the room and how they're attaching to these other women by volunteering and being and helping with childcare at the same
Uh-huh.
time.
That makes sense.
Or there's like our in our community, we have an agency called a Friend for You, which they're not licensed therapists, they're peer support,
Uh-huh.
but it's in the way of connecting with another individual during a hard stage in life that can
Mm.
be a peer support and a mentor type role. So there might be some other agencies like that that give you an
Uh-huh.
idea of like, this is like a one-on-one experience. We meet for coffee once a week and I'm not peer support.
Mhm.
It might feel similar to what it might feel like in therapy. I'm not giving the advice, I'm showing up for them though, and we're
Right.
in those one-to-one interactions the same.
Yeah, that's a great call. That's really interesting. Yeah, and I had seen a similar volunteer role somewhere here locally, like a peer, yeah, a peer specialist or a peer support. So that's an interesting opportunity. Okay,
Yeah.
Yeah,
that's
and
awesome.
depending on the path that you go, you might look at it like one of the bigger community mental health agencies actually had they hire peer support roles
Okay.
there, and they do get some training in counseling and how
Hmm.
to meet people where they're at, but it's someone that maybe needs a higher level of support than what they're getting just from a weekly session with a
Uh-huh.
therapist. So they might have this peer support role that they
Uh-huh.
do get trained in, like tax services, so crisis assessment
Okay.
services or addiction services or something like that so they can still meet with those individuals. And a lot of large community mental health agencies have roles like that that might not necessarily need you to go to school
Be
if you just
licensed
wanted to
or yeah.
explore it first and then decide if you wanted to go
Yeah.
on.
Go on with that. Okay. That's helpful. Yeah, I think it's one of those things you can learn a lot about it, but you kind of already start anticipating, like, well, I feel like it's hard to really know
Yeah.
until you kind of get in there and have exposure and have kind of experiences with in terms of being a clinician, with
Hmm.
people. So that's
Yeah.
helpful.
Yeah. Well, in schooling, like you get a ton of experience. My student right now will be with me for a year and a half
Okay.
and needs 800 direct hours
Wow.
in order to graduate. So the amount of experience they will get in their clinical setting is a ton.
That is a
Yeah.
lot.
That is a
Yeah,
lot.
I imagine is that one of the harder parts of getting a degree in the education? Or do you work with a lot of
I think
students?
it's yeah, I think is where you get the most experience, to be perfectly honest. I think you're going to learn the most in those settings. It's where you're going to actually put theory into practice.
Mhm.
And really, even though you do mock role plays and so forth in school, until you're seeing someone else in those vulnerable states, you don't know how you're going to respond.
Yeah,
Yeah.
that makes
Oh
sense.
man. Well,
Yeah.
I don't have any more questions or anything to dump on you, but
I know, sorry,
um,
Nikki. We
I know
just
I'm just
really took you
she's like,
into
I
some
didn't know if
personal corners.
signed up for this, but
No, I told Lauren this.
uh,
I was like, Lauren, I have ADHD. So if you want to rein me in, you better like
no. I mean, I think we
direct
all
me.
are just
Otherwise,
we're
I will
all
go, like, I can go on this stuff for days and
yeah.
days and days.
Yeah.
You give me
Well,
one topic and I can
like you were
easily talk
saying,
about it for
like
an hour.
this should be a whole series, but if you ever have ideas and you want to come
Mhm.
back on and just because like basically our listeners, I mean, we don't have like a huge following by any means, but it's all people around our age that are very like our one of our most popular episodes is when we mentioned that we would love a menopause midwife and like someone to
Mhm.
we just I think everyone has so many questions about what we're all going through right now. And
Yeah.
obviously mental health is just really important right now with everything in the world. But
Mhm.
if you ever want to come back on or just have something you think that would be really good for our listeners, we are totally open. And we just want to thank you
Yes.
so much for coming on and
Yes.
taking all of
Yeah.
our somewhat random questions, but thank you so much.
Yes, thank
Yeah.
you so much.
Absolutely.
And
Yeah, it
then,
was
Yeah. It was a
it's been
lot of
great.
fun. I would love to come back. We could come up with some. We'll think
okay,
of
sweet.
some directed series and
Yeah,
I
For
can definitely
sure.
bring that place there. I mean, we could go just on sleep. We could do
yeah.
some CBT
I
Oh,
know.
I
training
want a
just on
whole.
sleep.
We should just start a secondary podcast on you. Just solve my
Sleep.
sleep problems, but we can just share it with the world.
Get Lauren to sleep
Yeah.
without
I will
drugs. That
say
could be
I'm
a
on
whole
dates.
project.
I will say I'm 2 nights ago. I realized I went to bed without taking my
Oh.
Unisom. And I woke up at like 1 in the morning, but I realized that I fell asleep. I was like, "Oh my god, I fell asleep without my medicine." So I was like, "This is amazing." And then I was maybe
That's what
up
you
for
need,
2
a
hours.
placebo.
Yeah, I needed
Oh.
placebo. Then I was awake for about 2 hours, but fell back asleep and then woke up about 6. So did I get a ton of sleep? No, but I fell asleep and fell back asleep knowing I didn't take the medicine. So then last night I was
That's
like, "Oh, I
good.
don't need it. I'm gonna do it." So I did it again. I actually fell asleep like around 11 maybe, was up again from like 1 to 3, but went back to sleep. So I'm like trying to decide if it's better to keep training myself to sleep without medicine, or if I'm gonna be like so tired for lacking all that sleep that I should just take it tonight. But
Yeah.
We got
obviously,
to put some other things in place too.
yeah,
So your sleep routine,
yeah,
get your sleep routine.
Yeah.
The research shows us
okay,
4 or 5 tasks in the same order
okay,
with consistency
yeah,
allows us to train our brain that it's bedtime. So
okay.
they're all calming, de-escalating tasks that you do. No screen time at all for an hour before bed, so our body can naturally increase melatonin. That's how we develop it.
Does Kindle
If
Yeah.
we're
count? Like,
depleted of melatonin, if we're doing screen time before bed, our body's not ever able to initiate it on its own.
does a Kindle count as
Ah,
screen? Yeah.
yeah.
Okay. Wow.
Yeah.
You could get a paper book,
Switch to my audio. I have a paper book, but
a
oh,
real
you mean
book,
paper
paper
book? You
book,
mean real book?
like
I
a
was like,
real
my
book.
Kindle is called a Paperlight. So, but I do switch to audio right before I fall asleep, but probably only for like
Yeah.
10, 20 minutes.
And it
Anyway,
just
that can
can't
be a
be
whole.
stimulating. Like, so it's gotta be
Okay.
dull. It's gotta be
Okay.
really, really dull where
So
you're not like engaging.
Yeah.
So it's
Mhm.
okay, like it can be calming and it can't be screens, but the idea, Nikki, is that like if you do the same exact things in the same order, then
Every
that is
night.
the pattern is what trains your brain that like it's time for sleep.
I mean, think of kids. How do we
That
sleep
makes sense.
train kids?
Yeah.
I
Right.
mean, it's human behavior, right?
Yeah.
Just
We sleep train kids the same way we sleep train adults. Is we have to have the same activities, and
yeah.
research shows us it has to be 4 or 5 activities
Yeah.
in the
Okay.
same order every night. And also same wake up time every day. Don't fluctuate your wake up time. And I think that's the hardest for us moms because if we get a chance to sleep
Yeah.
in, we're
And
like,
we want
yes,
to.
my
Mhm.
partner like
Yeah.
allowed me to sleep
Oh,
in 2 more
Yeah.
hours today. Like I'm
Yeah.
taking it. And it's like, but that might actually reset some bad
oh, sleep.
kind of habits
Was
when you're
that
trying to
Yeah.
also
sleep train.
then the same go to bedtime? Because like if it's like a Friday
So
night,
initially, so
obviously.
CBTI training actually identifies you focus on, like if 7 a.m. is your wake up time every day.
Hmm.
And with kids, it's probably more like 6,
Yeah.
right?
Hmm.
So, I
Mhm.
mean, 6 a.m. is your wake up time every day on the weekend, no matter what. And then what you do is you start to put these sleep habits into place, right? So those activities that you find, and it can be simple. It's like I take a warm shower, I do my face routine, I drink a cup of sleepy time tea,
Hmm.
right? Like I
Mhm.
spray my pillow with my lavender spray,
Yeah.
like it can be these simple tasks, but in the
Mhm.
same order. So having those in place, but you actually keep yourself up until you're ready to fall asleep. So you
Okay.
don't associate your bed with any negative associations about sleep. So you're up sitting downstairs at the table on the couch, no screens, but maybe you're reading your book
Yeah.
or, or just trying to take in some quiet until your body's telling you it's tired. And
Okay.
so initially you are sleep deprived because sometimes you don't get to bed until like 1 or 2 because
Yeah.
that's when your body says it's finally
Interesting.
tired.
Yeah.
But
Okay.
then eventually, but you keep that wake up time the same. And then eventually that bedtime moves back until you
Okay.
get into a better routine. And that's what stabilizes it.
Okay. I've
Huh.
been messing up because my husband, he goes to sleep at like, we put our kids to bed and he's out. He goes to sleep as soon as the kids are down. So I've been like, just as like a feeling like I'm bonding with him, go get in the bed at the same time as him. But then I stay up for what, 4 more
Oh,
hours to like read
reading.
and scroll and, try to get
Yeah.
tired.
Right.
So I'm definitely not just sleeping in my bed, but so maybe I should move
Yeah.
that to,
Right.
maybe I should like tell him good
Yeah.
night and then go back to the couch or something. Anyway,
Yeah.
that can be a whole separate series. Sorry. We're like way
Yes.
maxed
Yes.
out on
We
our
could
That's
do a
time,
good
but
series on
though.
sleep for sure.
yeah.
Yeah. But those
No.
are some to retrain your body. You have to
Yeah.
do that. And it's not that you're always going to go to bed at 1 a.m. It's that
Right.
your body's going to learn to go to bed earlier with
Yeah.
that consistent wake up time.
Yeah.
Okay.
Well,
Okay.
I know sleep is a common issue too, Lauren. So it's not
Oof.
just
Yeah.
Oh,
yours, but like especially in
Man.
this
absolutely.
phase of life.
Good Lord.
Yeah.
Yeah, there's a lot.
Ugh.
Well, thank you
Okay.
so much,
Thank you
Nikki. And
so much.
we would love to have you back anytime. So I'm sure
Yes.
we're all going to be brainstorming because I'm sure there's
Yes.
lots of great opportunities.
Yeah.
And thank you so much for sharing your expertise with us
Yeah.
and your experience. And yeah,
And
we really appreciate
Yeah.
it.
you can
Yeah.
follow
Thanks
Nikki's
for having me.
practice at Inner Shell Therapy LLC on Instagram, also on Facebook at the same slash. So, but I'll put a little thing up with all of your how they can follow you and your practice and everything. So, but yeah,
And
thank you again.
And also, listeners, let us know if there's something you want to talk about in the mental health space, a
Yes.
topic or an area or something you're struggling with, that maybe we could talk about again. Would be great.
Yes,
So yeah, let us
please.
know. Hit us up.
Yes.
Yeah.
Okay. Thanks again,
All
Thanks,
Nikki.
right.
Nikki.
Bye,
All right.
guys. Thank
Bye.
you.
Okay, well, that was your mental health session for the day. Hopefully, that'll tide you over for a couple weeks.
Yes.
Maybe she solved some of your problems. I know she gave me some insight into my own. But yeah, that was super fun. Lauren, did you feel like
Yeah,
that
same.
helped you lean one way or the other about career wise?
Yeah, I mean, I think she was really helpful in just helping me think about what steps to take next and like how to focus in on maybe what population of people that I'm most passionate about. Because I think for now I've been doing a lot of, intellectual learning, but I think I need to now pivot to like, okay, what do I want to do?
Right.
What's going to keep me engaged and who
Yeah.
do I care most about helping?
Yeah.
So yeah, a lot to think about with that, which I really
Yeah.
appreciate. And then different ways to get involved,
Yeah.
and kind of get some lightweight experience,
Yeah.
to see how I do at helping people.
Well,
I don't know.
you have 2 weeks to make some progress on that because our next episode
Wow.
is our challenge update. And so that will be
Yes.
in 2 weeks because we skip a week. So our next episode
Yes.
is our challenge update. I'm pretty sure
And we're
I'll be
going to
able
get to read the
post my
story.
story. Yeah.
I'm
Yeah.
psyched.
So,
Do you have the end
yeah.
figured out yet?
No. I did
Oh my
before.
gosh.
And then I introduced a new character and now I don't know where the end's going to go. So
Oh.
working on it. Working on it.
Okay.
But
well,
okay, 2
it's
weeks.
fun to know that you don't yet know the end,
Yeah,
but we
yeah.
all will in 2 weeks.
Yes,
So
in 2
stay
weeks.
tuned.
Stay tuned.
All right.
All right.
Until next time.
Until next time. Bye.
Bye.